Hi, my name is Dr. Avalos and I'm here at SunBrite Dental, and I usually get a lot of questions regarding tooth decay. So today I just want to go over the usual questions that I get so that maybe I can answer some of the questions that you have regarding tooth decay. So let's just start with the basic. What is tooth decay? Decay and rot. Two different words, same thing. So tooth decay is rot found in our teeth, and how our teeth rot is the same process that you've seen in fruits and vegetables. So just like that banana or apple or avocado that you've seen rot, once it starts rotting, the rot doesn't stop on its own. It'll just continue. And if left to continue and it's near any other fruit of its own kind, then the rot then can spread to the others. I think that's where the saying, one bad apple will spoil the rest of them. Yeah, that saying is so true for teeth as well. If you've got one tooth rotting and not taken care of, the rot then can spread to the other teeth. The other question is, what causes dental decay? And funny enough, I usually get this question, Doc, I don't get it. I brush my teeth. I even use the water pick, right? Again, usually the missing component to success of fending off rot from happening in our teeth are regular visits to the dentist. So I'm going to show you my model. And imagine my fingers are toothbrush bristles, and I'm going to show you from the side. So when we brush, we remove most of the plaque and most of the harmful bacteria that can cause tooth decay. However, because our teeth aren't flat, it's virtually impossible for us to get everything. Teeth have funny nooks and crannies that we just cannot reach. That's where we dental professionals come in. We help you get whatever areas that you're missing. Usually they're the teeth further in the back, because those are the ones that have the most nooks and crannies. And when we eat, the food doesn't usually stay around our front teeth. Our front teeth, their main job is just to cut or slice into food. That's what we use to bite. Most of the chewing happens with our back teeth. So that's where most of the food or the chewed up food stay around and in between our teeth. And if you look at my model, see this side? This is the picture of health. The gums are pink and tight. Teeth are not rotting or breaking. This side leads to all the reasons why patients don't like the dentist. That's when huge problems occur. You know, gums are bleeding, are puffy, teeth can be rotting or breaking, and if the gums recede enough, teeth then can get loose. All of this can be prevented if the patient just follows the trifecta of success: brushing twice a day, flossing or using the water pick once a day, and coming to see the dentist on a regular basis. And here, if I see that a patient is more at risk of these problems happening, then I will recommend you to come see us 4 times a year. So that's every 3 months instead of just twice a year. So totally doable, totally can prevent this side from happening and keep you here. So the other question I get is, can tooth decay lead to other complications to the body? And the answer is yes. So I am going to show you the other side of my model, which is like the colored television version of the black and white x-rays that we dentists look at. So I'm going to turn this around. Ta-da! Right? So teeth are living in that every tooth gets its own blood supply. So blood from the heart and lungs go up the root through the middle, and this is where the blood drops off the nutrients that we get from the food we eat, the oxygen from where we breathe, drops it off for the tooth to use, goes back down, back to the heart and lungs, and all over again. So teeth are connected to the body, and we're all parts of the body are connected through this network of blood vessels. You see this dark spot here? That is tooth decay or rot. Now, the design of our teeth is the exact same design as our nails. Something hard, right? And I'm going to click on my nail, surrounded by skin. Skin in the mouth, we just call gums. And all your life, you've been able to cut your nails and it doesn't hurt. And that's because the part that we're cutting is the non-living part of the nail. But if you've ever accidentally cut too short or even torn a nail where it got to the pink part or the living part of the nail, that's when it hurts. Same design as teeth. When teeth first start to rot, it usually doesn't hurt because the rot is in the non-living part of the tooth. However, if you remember, rot is rot. It doesn't matter what's rotting. The rot will continue to rot, and it'll continue to get bigger and deeper, so that once it gets closer and closer to the living part, that's when pain or sensitivity starts to set in. So we would like to, one, prevent teeth from rotting. But if we cannot prevent teeth from rotting, then how we dentists deal with rot is probably how you deal with rot. Meaning, you've probably have decided in your life before, let me just cut out that rotten part of the piece of the fruit, because it would be such a waste for me to throw away the whole thing. That is the same logic that we dentists use when we're taking a look at our patient's teeth. That doesn't look good, but gosh, it would be such a waste for me to pull out the whole tooth. Let me just cut out the rotten part, and depending on what stage of rot I catch it at, that's how I determine what I need to do to make my patient's tooth whole again. The next question I get is, can tooth decay return to normal? And the question is no. Again, rot is rot. So once a piece of fruit, vegetable, or meat has started rotting, it doesn't reverse back to how it was before it was rotting. You either need to, if you catch it early, you need to cut out the rotten part. But if you've caught it too late and too much of it is rotten, then that's when we decide to toss the whole thing out, right? So it's the same logic that you have used when you're looking at your pieces of fruit and vegetable and are about to prepare them. If a small piece of it is rotting, sometimes you've decided, I can save this. Let me just cut out the rotten part. Same thing that we dentists say when we catch it early. And then there's some times where like, oh, dang, how did that happen? And that's usually like the banana with lots of dark spots. And you're already calculating in your mind, by the time I cut out everything I need to cut out, there's really nothing left. It's so not worth it. Dang. All right. I guess I have to throw it away. It's the same logic that you've used, that we dentists use when we're taking a look at our patient's teeth. The next question is, what are some of the treatments for tooth decay? So, depending on what stage of rot we catch it at, and I'm going to show you my model here. You see how this dark spot is really small? That's early stage rot. Once we cut it out, I've created a small hole in the tooth. That's when I decide to fill it up. So that would be a filling. Now let's say this dark spot is now half the tooth. I'm still going to use the same logic. Let me cut out the rotten part because it would be such a waste for me to take out the whole tooth. But since now I'm cutting out a bigger chunk of the tooth, essentially I've made the tooth weaker. That's when I decide to put a little helmet on the tooth. I wish we dentists called it helmets, because it's the same reason why football players wear helmets. They can tackle each other without fear of cracking their skull. It's the same thing. Let me put a helmet on my patient's tooth so I'm not afraid when my patients chew on nice crunchy things like chips, nuts, or ice that the tooth is going to break. But professionally, it's called a crown, or the other word for it would be a cap. That would be middle stage rot. Now, if you look at this tooth, the rot has actually gotten to the living part and has started dying, or depending on when I get to it, it's been dead. When we see this and we feel like we could still save the tooth, this is when I decide to do a root canal and a crown. So this is how the tooth looks before, and this is how a tooth would look like after. This is how a root canal and crown would look if the x-rays were in color. This is late stage rot. Then end stage rot, again, it's like that banana, too many dark spots, and you're already seeing, man, by the time I cut everything I need to cut out, there's really nothing left to it. Okay, I gotta throw it away. Same thing with teeth. If the rot is just too much and there's really nothing left once I cut out all the rot, then that's when we decide to take out the tooth. And now our conversation is, how are we going to replace this tooth that we're taking out? The next question I get is, how do I stop tooth decay from spreading? And the answer is, take care of it as soon as it's discovered. So going back to the pieces of fruit, like you gotta cut it out so that the rot doesn't spread to the other fruits. You gotta either remove it or cut out the rot. It's the same thing with teeth. If you have been told and shown that one tooth or a group of teeth are rotting, take care of it as quickly as possible. And it doesn't really make logical sense if you've got several teeth rotting. Yes, we can phase it out, but it needs to happen in a timely manner. A lot of the feedback or usual knee-jerk reaction is, okay, doc, I'll take care of this, but then when my insurance renews next year, then I'll take care of this. See, rot is rot. Doesn't matter what's rotting. So just because you wait to take care of it doesn't mean the rot is just going to stop and wait. The rot will continue, and however long it takes for you to take care of all the rot, that's how much time you're giving the rot the possibility of spreading to other teeth, which then can lead to additional expenses that are unnecessary if you were to just figure out how to take care of it in a timely manner. The next question I get is, when should I see a dentist about treating tooth decay? So if you've been told by a dentist that you've got cavities, so cavities is just another fancy word for tooth decay or rot, try to take care of it as soon as possible, especially depending on what stage of rot we catch it at. Because if it's middle or late stage rot, chances are the rot has had a chance to spread. So at that point, you want to isolate the rot to keep it from spreading to any more teeth, which then can also drive up the cost of your treatment. I'm hoping I was able to answer some of the questions that you've had regarding tooth decay, but if I didn't answer all your questions, please feel free to reach out to me. You can reach me at 702-459-0303. You can also text me at that same number or email me at info@sunbrite.com. SunBriteDental.com. And we spell bright, B-R-I-T-E. See you next time.